Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be going over visual disorders. We're doing another Kahoot. Before I get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a next generation NCLEX review session, part 1, part 2. You can sign up for a private tutoring session, a private consultation session. You can get audio lessons. If you have to do really, really well on your next exam, be sure to check out the audio lessons, see if I have one on my website that actually matches the content that's going to be covered on your next exam. And guys, it's in the woodworks coming very soon. I also have some other great resources that I will be offering on my website. Again, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, TikTok, Instagram, Facebook. Right here on YouTube, my handle's the same everywhere, Nexus Nursing. Without any further ado, guys, let's get started. Visual disorders. First question. Your patient's diagnosed with glaucoma. Which of the following symptoms would you expect the client to report? Would it be sudden onset of severe eye pain and halos around lights? Would it be gradual loss of peripheral vision and difficulty adjusting to darkness? Would it be complete loss of vision in one eye and sudden eye swelling? Or would it be a gradual loss of central vision with straight lines appearing wavy? All right, guys. So the correct answer is gradual loss of peripheral vision and difficulty adjusting to darkness. That is a clinical manifestation. Now, glaucoma, that's increased ocular pressure. Professor D, do I have to know what the normal range of that pressure is? Absolutely. Committed to memory. 10 to 21, that is your normal range. Higher than 21, that ocular pressure is increased, okay? You need to know this. Now, let's look at the wrong answer choices. The first option, it says sudden onset of severe eye pain and halos around lights. That is acute angle glaucoma. Next, complete loss of vision in one eye, sudden eye swelling. That could be due to some type of foreign body, some type of trauma, some type of infection or disease to the eye. There's no specific disorder related to this, but when you see a complete loss of vision in the eye and eye swelling, it can be some type of allergic reaction or trauma to the eye. And last, gradual loss of central vision with straight lines appearing wavy. We see that in what? Macular degeneration. Professor D, do I have to know the differences in the visual disorders? Absolutely. These disorders that I chose to do on this Kahoot, they are the visual disorders. If you get a visual disorder on NCLEX, these are the types that you're most likely to see. Now, I don't write NCLEX. I do not work for NCSBN, so you very well may get another one, but I'm just letting you know from the feedback that I've gotten from my students, thousands of them who's gone and taken NCLEX. When it comes to visual disorders, these are the ones that they've reported that they've seen the most. Okay? All right. Which of the following statements about cataract surgery indicates a need for further teaching? Is it, I should avoid lifting heavy objects for a few weeks? I should sleep on my back or the unaffected side for the first few nights? It's okay to rub my eye gently if it feels itchy, or I will use the prescribed eye drops as directed to prevent infection. Very good. It's okay to rub my eye gently if it feels itchy. You see that word gently is very misleading, and NCLEX will do that to you. They will throw in a gently or a softly or a kindly. Guess what? If it's contraindicated, it's contraindicated, and we don't care how gently or softly you do it. It's contraindicated. Think about it. This patient just had surgery. By the way, guys, what do I tell you about surgery? Any patient who had surgery, it doesn't matter what type of surgery it is. It could have been removal of cataracts, such as this patient. It could have been an appendectomy. It could have been an amputation. What are the three things we're always going to be concerned about when it comes to surgery? Let me know on the live. Who's been following me? Who knows? What are we concerned about when it comes to surgery? Thank you. Infection. What else? Bleeding, hemorrhage. What's the third thing? You forgot the third? We have infection already. We have hemorrhage. Okay, I'll tell you guys. DVT/PE. We're concerned about the patient developing a DVT or a pulmonary embolism, which is even worse, by the way. So anyway, this patient who just had cataract surgery, let's talk about this. Cataract, that's that opacity, that cloudiness of the lens, right? They just got it removed. Which one requires further teaching, which means which one's a wrong answer? Because if someone says this, they said something wrong, and that's why we have to teach them further. Them saying that area that I just had an invasive procedure on, it's okay to go ahead and rub it and put my nasty, dingy, pathogen-filled fingers all over it. Go ahead and mess with that insertion site, right? Cause trauma to that insertion site. Possibly introduce microorganism to that insertion site. Absolutely not. So that's the one that requires further teaching. Okay? Which of the following findings is most characteristic of diabetic neuropathy? Retinopathy, excuse me, retinopathy. Here are options: severe eye pain and sensitivity to light, loss of peripheral vision and tunnel vision, blurred vision and the presence of dark floaters, or complete blindness in one eye. We're talking about diabetic retinopathy. By the way, guys, diabetic retinopathy, this is where there's like abnormal vessels, abnormal vessel formation in the retina. And here's the thing, the reason that these abnormal vessels are formed in the retina is because of what? Hyperglycemia. That's why it's called diabetic retinopathy. Okay. And so, anyway, the clinical manifestation you're most likely to see is going to be the blurred vision and the presence of dark floaters. Now, let's look at the other answer choices. We have severe eye pain and sensitivity to light. That's what? Angle glaucoma, acute angle glaucoma. Next, loss of peripheral vision and tunnel vision. Correct? Glaucoma. And last, complete blindness in one eye. That can be due to trauma. It can be due to infection. It can be due to any disorder that has happened long enough or is traumatic enough to the eye, right? There's not a specific disorder connected to that. Do you have to know the disorders for those other signs and symptoms that I just mentioned? Absolutely. Which is the best nursing intervention for a patient with macular degeneration? Is it encouraging the use of a magnifying glass for reading? Is it teaching the client to limit fluid intake to reduce eye pressure? Is it advising the client to increase peripheral lighting around the home? Or is it encouraging the client to avoid bright lights and wear sunglasses indoors? Encouraging the use of magnifying glass for reading. This is the correct answer. So when it comes to macular degeneration, guys, part of the retina, it's called the macula. That's why it's called macular degeneration, right? That's part of the retina. Part of the retina is broken down. It's damaged. And usually this damage is caused by the aging process. Okay. And what it affects most is that central vision. So, and I kind of gave you guys a clue because the picture I put on there was somebody reading. You know, their central vision's affected. So one of the teaching is encouraging them to use a magnifying glass when reading. Amory Page said magnifying glass. I didn't know they still made those. Are you serious? Or are you just trying to make me feel old? Next question. Which of the following symptoms would you expect to see in retinal detachment? Would it be increased tearing and mild redness in one eye? Would it be severe pain and photophobia and nausea? Would it be sudden flashes of light, floaters, and curtain-like shadow over vision? Or would it be gradual blurring of vision and difficulty focusing? Okay, very good. Sudden flashes of light, floaters, and curtain-like shadow over vision. First of all, retinal detachment, this is an ocular emergency, okay? It's an emergency of the eyeball. But what's happening is the retina has detached from its position, okay? Pulls away from the normal position. Now, let's look at the other choices. Increased tearing and mild redness in one eye. It could be from irritation, it could be from allergy, it could be from a foreign body. Lots of things can cause that. The next one, severe pain with photophobia and nausea. That is acute angle glaucoma. And last, gradual blurring of vision and difficulty focusing. That can be due from a refractive error. Usually, actually, that is from a refractive error, okay? But it could be a refractive error. And we can see this as an adverse effect of many drugs, like what? Digoxin, if the patient goes into digitoxicity. Sometimes it's a systemic issue, but most often it is a refractive error that causes this. But again, lots of drugs can cause it if the patient's having a toxic level or their adverse effects. True or false? For chemical injury to the eye, ocular irrigation should start immediately and not be stopped until paramedics arrive. Is this true or is this false? It's true. When it comes to a chemical splash, a chemical injury, something that's gotten in some liquid or something that's gotten into the I can't speak. Eye, you're going to irrigate that eye. We want to dilute that crap, whatever it is, right? So it causes the least amount of damage, and you're going to keep irrigating that eye until help arrives. Now, this is different than, let's say there's a foreign matter. What if there was a foreign matter that was stuck into the eyeball? Are you going to irrigate that eye? Absolutely not. You can cause trauma, right? You're going to not touch it, definitely not pull it out, right? Because that foreign body might be what keeps the patient from hemorrhaging out, but you're gonna not touch it, call 911, get that person to the hospital immediately. But so you have to know the difference of if there's a foreign body versus if there's some type of liquid chemical to the eye. That's right. Eye shield. Wayne said eye shield. As long as that object is much smaller, that the eye shield will not touch the object. Absolutely. And also, by the way, what that another reason eye shield, what it helps is that imagine you have a foreign body, that eye shield helps keep the eye from going like this and even causing more trauma. Select all that applies. What drug orders would be expected for a patient with cataract before surgery? Here are your options. Mydriatic agents, NSAIDs, topical antibiotics, anti-anxiety drugs, miotic drugs, anticholinergic agents. So the patient is going to have cataract surgery. Before surgery, what type of medications do you expect to be ordered for this patient before they have the cataract removal? Okay, this is pre-op. Select all that applies. There's more than one answer. Okay, let's talk about this. The first one, mydriatic agents. Absolutely. And guys, you have to know the difference between mydriatic agents, which is red. I'm happy 55 of you chose it. And meiotic agents, which is green. I'm happy only 35 of you guys chose that. The difference, you see that D in mydriatic? That D stands for dilation. It causes pupil dilation. Before surgery, you expect mydriatic agents to be administered to the patient. NSAIDs, absolutely decrease inflammation. Topical antibiotics, absolutely. The patient's about to have an invasive procedure. There's a chance we might introduce bacteria. We don't want to do that. Anti-anxiety drugs, yep, because people are going to be nervous before surgery. Meiotic, these drugs do the opposite. They cause people what? Constriction. No, you don't expect that to be ordered. Anticholinergic agents, absolutely. Remember the little poem I taught you about the anticholinergic agents? Those are adverse effects you're going to be concerned about. Can't see, can't spit, can't pee, can't, right? Can't see, blurred vision, can't spit, dry mouth, can't pee, urinary retention, can't, constipation. But of course, this is topical anticholinergic drugs that we're talking about, but you still have to know those adverse effects. Okay. All right. True or false? Almost all patients with an untreated retinal detachment will become blind in the affected eye. Almost all patients with an untreated retinal detachment will become blind in that eye. Is this true or is this false? It's true. Why did 25 of you guys choose false? Why do you think I told you this already? Retinal detachment is an ocular emergency. Why do you think it's an ocular emergency? The retina literally had detached from its a proper alignment, proper position. This patient will lose their eye if this is not treated. Patient's going to have surgery. Thank you, Tay made a very good point. Thank you. Thank you. Okay. So some people on the live were concerned with the word all because I always teach you if you don't know what the answer is and you see an all inclusive, all, always, never, only, none, those type of words, stay away from the answer. But look what I wrote. I said almost all. I didn't say all because all is all inclusive, right? That would have made the statement wrong because there's usually exceptions to the rule. I didn't say all. I said almost all. What does that mean? Many. Why didn't I use the word some? Because some is a word that NCLEX does not like. Some is wishy-washy. NCLEX does not like the wishy-washy type of nurse. And I do not even want you to get in the habit of thinking of that word. That's why I didn't use the word some. Okay? And some isn't even a strong enough word because it's more than just some. It's many, it's several, it's almost all. So if you have 100 patients that have retinal detachment that's not treated, 99 of them are going to go blind in that eye. So almost all. Does that make sense? Guys, this is the difference. You got to learn how to think critically. You can't try to be a robot. This is how NCLEX catches you. All right. Don't say I didn't warn you. Next question. Scleral buckling is a surgical procedure to treat which visual disorder? Would it be cataract, retinal detachment, chronic open angle glaucoma, or age-related macular degeneration? We're talking about the procedure called scleral buckling. Yes, you guys have to know this procedure. Huh. The correct answer is retinal detachment. I thought more of you guys would have chosen the correct answer. Like, you guys have to know, like, for real, for real. This is a famous question on NCLEX. You know, they'll give you a whole case study just to get to the point of them wanting to know what the procedure is for retinal detachment. This is not one of the things you can just not know. Okay. Make sure you guys know this procedure. Anyway, it's a retinal detachment. Um, for cataract, it would be removal of that opacity, um that lens, right? For chronic open angle glaucoma, that would be procedure called ALT. I don't remember what the ALT stands for. I know the L stands for laser because it's a laser that's used. ALT. I want to say argon laser therapy, but I might be wrong. Definitely a laser is used. You got to know that for chronic open angle glaucoma. And for age-related macular degeneration, a laser is also used. Um, I think that procedure is called photodynamic therapy because it's a laser that uses light. So that's why I'm thinking it's called photodynamic, but it's something dynamic. I'm almost sure it's called photodynamic therapy, but whatever. The point is, a laser is used for that as well. So make sure you know the procedures for chronic open angle, age-related macular degeneration, cataract removal, and especially retinal detachment, because you may get one, even two questions about scleral buckling, okay? Okay, yes, photodynamic is right. Thank you. I have thank you. You guys are my fact checkers. Last question. Select all that applies. After cataract removal, which actions should be restricted? Select all that apply. So the patient just got the cataracts removed. Which actions should be restricted? Neck flexion, neck hyperextension, bending down, coughing, performing Valsalva maneuver, rubbing the surgical site. After cataract removal, look at that cataract. Look at that opacity of the lens, right? After removal of that cataract, what should be restricted? Neck flexion, neck hyperextension, bending down, coughing, performing the Valsalva maneuver, rubbing the surgical site. All of them. All of them increases ocular pressure. Flexion, neck flexion, the head going down towards the trunk. Extension, the head going away from the trunk. Bending, by the way, also not even, what's the word when it goes from side to side? Flexion, extension, rotation, duh. That also can increase the ocular pressure, right? We want the head in a neutral position, aligned. Bending down, increase ocular pressure. Coughing, sneezing, laughing too hard with the mouth closed, ocular pressure. Performing the Valsalva maneuver, that's like bearing down. You know how if you're constipated and you're bearing down, or you're urinating, but you think you're done, but you feel maybe you have a little bit more urine in your bladder. You kind of squeeze to try to get that little bit of urine. That bearing down, that's the Valsalva maneuver. That increases ocular pressure. And of course, duh, rubbing that surgical site, that's going to increase ocular pressure. So all of those guys are contraindicated. It should be restricted. And that's it for this video. Anything that I mentioned, even if it was not the answer, if I put it as an option, go back, study, make sure you know it, because whatever I put as the answer, that may not be what you get on your exam, but one of the other options may be what you see on your exam. So listen, and this is across the board, not only for this Kahoot, but anytime you see me talking about something, mentioning something, pointing to something, typing something, if I present it to you, that means it's important for you to know. You're very likely going to see it somewhere within your academic career of pursuing your nursing degree. All right. So make sure you guys study, make sure you know it. Those of you who are watching this on YouTube, please let me know in the comment section what you thought about this video, what you'd like to see me cover in the future, and let me know what format. Would you like it in a Kahoot format, such as this interactive activity that we're doing now? Would you like it in a lecture format where I'm just teaching about a subject? Or would you like it in a Q&A format where I present these questions as question answers rationales? Let me know in the comments section. Be sure to check out my website, nexusnursinginstitute.com. There you can sign up for next generation NCLEX review sessions. You can sign up for a private tutoring session with me. You can sign up for a consultation session with me. Maybe you want to pick my brain about something. If you're currently a nursing student and you're not doing well, you have to do really, really, really well on your next exam or next couple exams to even stay in the program. Check out my audio lessons. You can get those at my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, TikTok, Instagram, Facebook, and of course, right here on YouTube. YouTube, this is where the serious learners come. My handle is the same everywhere, Nexus Nursing. Now, let's see how you guys did.